Hola, muy buenos días y bienvenidos a esta sesión informativa de la Organización
Good
Panamericana
morning and welcome to this press briefing here on COVID-19 with PAHO here this Wednesday, April 7th, World Health Day. My name is Sebastian Uriel with the Communication Department, and we will be here for about an hour and accepting questions up to the end. We have already received some questions via email, and you will be able to ask your question through the Q&A button and live. Please do include your name and media outlet when sending your questions. Let me remind you that we have simultaneous interpretation into English, Portuguese, and French, and you can choose the interpretation language through the interpretation button. Dr. Carissa Etienne, PAHO's director, will be referring to the epidemiological situation in the region, as well as the impact of inequities. We have Dr. Jarbas Barbosa, Assistant Director of PAHO, Dr. Ciro Ugarte, Director of Health Emergencies, and Dr. Sylvain Aldigueri, Incident Manager for COVID-19 here at PAHO. Now, I would like to invite Dr. Etienne to share her remarks with you. Dr. Etienne.
Good morning, and thank you for joining today's press briefing. Let me take this opportunity to wish you a happy and thought-provoking World Health Day 2021. COVID infections continue to surge throughout the Americas. Last week, we had more than 1.3 million new cases in our region and more than 37,000 deaths. In fact, more than half of all global deaths reported over the last week were in the Americas. A sober reminder of the human toll of this pandemic. The epidemiological situation across the region is uneven. Infections are rising in some places and falling in others. In North America, cases and hospitalizations are climbing in Canada, while infection rates are slowing down in the United States and Mexico. Just as cases are decelerating in Belize, El Salvador, and Panama, we are seeing a rise in new infections in Costa Rica, Honduras, and Guatemala. In the Caribbean, populous islands like Jamaica and the Dominican Republic are seeing a dip in cases, while infections are going up in smaller islands like Martinique, Bermuda, and the US Virgin Islands. But nowhere are infections as worrisome as in South America, where cases are mounting in nearly every country. In areas of Bolivia and Colombia, cases have doubled in the last week, and all 4 countries in the Southern Cone have been experiencing an acceleration in COVID-19 cases, with uninterrupted community transmission in recent weeks. In the meantime, ICU beds are nearing capacity in Peru and Ecuador. Over the last week, the United States, Brazil, and Argentina were among the 10 countries in the world registering the highest number of new infections worldwide, and other countries were not far behind. Driving down infections starts by staying home and doing everything that we can to protect ourselves and others from getting sick. And yet, we are seeing that populations in the region slowly and steadily increase their mobility over time, even when public health and social measures were in place during this pandemic. More people are traveling within and between countries. And if these trends continue, our health systems will be in deeper trouble. Regardless of pandemic fatigue, we cannot ease public health and social interventions without good data and justification. our actions must reflect our reality. Slowing and then stopping transmission requires decisive action by local and national governments and the continuous vigilance from all of us. Today marks World Health Day, a day where we reflect on the importance of health and our promise to achieve health for all. With its theme of Together for a Fairer, Healthier World, there is no better moment to talk about the need for urgent change. Over the last year, this virus has greatly deepened the inequities that have long divided this region. While many of us have been lucky enough to continue working during the pandemic from the comfort and safety of home, half of our workforce relies on the informal economy. Staying at home would have meant foregoing their livelihoods. Many others remain or are newly unemployed. For them and the 22 million people who fell into poverty this year in our region, the financial strain of this pandemic has been devastating. Effectively fighting COVID-19 is impossible without addressing some of these inequalities and supporting the most vulnerable as they struggle to protect themselves. The good news is that vaccinations continue to move forward across our region. Today, more than 210 million doses of COVID vaccines have been administered across 49 countries and territories in the Americas. And thus far, PAHO's revolving fund has delivered more than 2.8 million COVID vaccines from the COVAX mechanism to 26 countries. And more than 300,000 doses are making their way to the Caribbean. But of course, vaccines are just one part of our COVID response. And we must continue to rely on public health measures to keep our populations and our countries safe. That's why PAHO has developed an interactive platform where countries can visualize the measures that were implemented and to compare that with how mobility has behaved over time. We can see peaks in mobility during specific periods such as Christmas, New Year's, Semana Santa. In addition, PAHO developed modeling tools to increase nowcasting and increasing those capacities at country level. Today, more than 15 countries across Latin America and the Caribbean are using this platform to inform their pandemic response. And we want to encourage others to follow suit. On World Health Day, we urge countries to make equity the guiding force of their COVID response. Countries must prioritize investments in health to keep people safe and healthy and economies strong. Health must be central to our efforts as we work to reduce inequality and to build more resilient societies. Every country, regardless of income, must make needed investments in their health systems and make healthcare more accessible to the poorest and most vulnerable. As we continue to fight this virus, we must do more than just stop COVID-19. We must commit to working together to build a fairer, healthier world. We must also take this opportunity to build a healthier region that's better prepared to tackle the next challenge and realizes our promise of health for all. Over.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. Now we are going to move on to the question and answer session. Please send us your question through Q&A button, and please include your name and media outlet so that we can identify the various questions we are receiving. The first question in English. Several journalists have asked about the suspension of vaccine shipment through the Serum Institute from India, and also the COVAX shipment to the region. Claudia Rabasa from CNN and Gloria Simnan from Associated Press in English asked the following.
India affect vaccine distribution vía COVAX en Latin America and the Caribbean. Y también Kay Mary Fletcher de Trinidad Express preguntó también en inglés, how soon after receiving their first shipment of vaccines would Caribbean islands such as Trinidad and Tobago receive its second shipment? Dr. Barbosa.
Thank you for these questions. The first question, the Serum Institute of India is deploying vaccines through the COVAX facility to 3 countries in Latin America. We have this vaccine for Bolivia, Nicaragua, and Haiti. So these countries can be affected by this decision from the government of India. The WHO Director General is in direct contact with the government of India. Many heads of states also are making appeals to the government of India to understand that the COVAX facility had an agreement with the Serum Institute of India, purchased the vaccines, and I think that is important to guarantee that these contracts can be fully accomplished so we can have the vaccines being delivered to all the countries. We are working on this topic, and this is, again, I think that a very important reason to have more solidarity, international solidarity, to have a better coordination, to have a better understanding that no country will be protected if all the countries in the world will not be protected. So it's very important to guarantee that the vaccines committed for the months of April and May to be delivered for these 3 countries in the region can be delivered, really delivered, sorry. We started delivering the vaccines through COVAX facility to the countries in Latin America. Next week, we will finish the first round, so every country in the region that is ready to receive the vaccine will have received the first deployment, but we have already started the negotiation with the producers in order to send the dates and the amount and the volume of doses that will be deployed to the countries in the second round. The idea is to accomplish until the end of May with the estimation that every country will receive around 2.2% of their population in order to use these vaccines to the priority groups. Thank you.
Gracias, doctor. Siguientes preguntas.
Thank you, doctor. The next questions are from Luke Taylor from British Medical Journal, and also Diego Nogueira from Reporter Brazil in English. Luke Taylor asks,
clearer that the COVID-19 crisis in Brazil is a threat to the region and the wider world? And if so, what should the international community be doing to address the crisis in Brazil? Y Diego Junqueira, de Reporter Brasil, pregunta, what kind of assistance can PAHO offer to Brazil at this time to control the pandemic? Dr. Alighieri?
Yes, thank you for these questions. There are many questions, at least 3 questions. So at this moment of the pandemic, the risk of massive epidemics in this region still exists, and exist in all countries that are not enough strict in implementing public health measures. Dr. Etienne, the PAHO director, alerted the public during her remarks last week on this. The situation in Brazil is concerning countrywide. our concern at the moment is also for the Brazilian citizens themselves in this context of health services that are overwhelmed by the number of severe cases to be managed in ICUs. Countries of the region and from other regions of the world can share experience on how they have been successful in dealing with a second or a third wave of the pandemic, including with implementation of public health measures through a joint coordination of the response at national level, the implementation of mass vaccinations programs, but also the strengthening of the epidemiological surveillance, including the genomic surveillance. There are many excellent experiences and successes that European countries and other South American countries can share. In addition, Brazil and the region of the Americas need access to more vaccines and need it now. Through global partnership, Brazil and other countries of the Americas should be able to receive more vaccines. We have to take into account that as of last week, 44% of global cases and 48% of global deaths have been reported in the Americas. So this region has been very much impacted by the pandemic since last year. So PAHO is working with Brazil from the very beginning of the pandemic through its country office. And this country office has been strengthened. We are working with the federal level, with the states, and with the municipalities. During January and February this year, PAHO has deployed technical teams to most of the states in the Amazon region, in the states of Amazonas, Roraima, Rondônia, Acre, Pará, and Amapá, and more recently in the south and southeast of Brazil, in Santa Catarina and Rio de Janeiro. And we can expand according to the request from the states. We have sustained activities at the moment dealing with laboratory surveillance, including the genomic surveillance, with the strengthening of a national network, which is coordinated by Fiocruz, and the establishment of regional hubs to process more samples for sequencing and tracking the evolution of the pandemic. PAHO is also strongly involved in the procurement and supply chain for oxygen, procurement of laboratory tests, and also medicines for intensive care units. As an example, during the last couple of months, PAHO has donated more than 400,000 antigen-based rapid tests directly to states facing a shortage of tests. So I hope I have answered the concerns of both journalists. Thank you.
Gracias, doctor. Siguiente pregunta.
Thank you, doctor. Now the next question is by Adolfo Picas from the Republic in Peru and Cesar Martinez Asanza from Peru 21. And they would like to know what PAHO's position is in connection with the potential participation of the private sector in the acquisition of vaccines, or if this is something that only governments can do. Dr. Barbosa. Thank you. Thank you very much for this question. This is a question that is common in several countries. The goal of the vaccine is to save lives. This is in relation with those individuals that have more risk of getting the disease, the elderly, and those individuals that have diabetes, hypertension, and in addition to protecting health workers and other workers with essential services so that they can continue to work and offer the care that the population needs. So under those circumstances, I think that the use of an from an ethical point of view and from the point of view of public health, the idea is to use the vaccine following the guidelines of the national plans, the national vaccination plans, so that they can be better used and so that the vaccines that are available worldwide can be better used. We have limited access. We do not have any excess number of vaccines, to vaccinate those that want to get vaccinated or are willing to pay. We need to vaccinate so as to save lives first, and also together with the public health measures to reach control of transmission. The use of vaccines by means of out-of-pocket payments could also deepen the differences that have been shown with the pandemic. And as our director just mentioned, the World Health Day that we are celebrating today, it is not possible to think that an older individual will have no access to the vaccine, but a younger person who has the money to pay may have earlier access. I think that we need to give priority to public health to save lives and to avoid transmission. Thank you. Thank you, doctor. The next question is by Kadin Shosa from Observer Media in Antigua and Barbuda, and it reads,
companies are looking toward the reopening of cruise tourism in the summer, including Antigua and Barbuda. Is PAHO concerned about the possible return of cruise tourism and the impact tourism is having on the pandemic in the region in general? Dr. Ugarte?
Thank you, Kadim, for this question. This is an important question because we are aware that the pandemic has had a huge impact on the tourism industry and also on the cruise ship industry, and particularly with the countries that depend vastly on this sector of the economy. It is imperative, though, to act with caution. Why? Because the transmission that was seen at the beginning of the pandemic in cruise ships, and also last summer when several countries in Europe and also in the Americas attempted to reopen the cruise ship industry and access to their ports, also showed an increase of number of cases, although at small scale. In this regard, it is very important to establish that even though the tourism industry and the cruise ships are implementing prevention and other measures in order to reduce the transmissibility, according to the current situation and the spread of the virus in all the regions, and particularly in the Americas, it is imperative that each of the countries do a proper analysis of the situation and also look at where is the origin of the passengers and others. There is a special advice that was released by WHO and also PAHO regarding what are the measures that have to be in place. And I recommend to look at those recommendations. The last one was published in February 12 this year, regarding, for example, the proof of vaccination that several travelers and companies are being asked to have in order to resume some tourism or travelers, international travelers. It is clear that there is no proof of safety, let's say, free of infection, and there is no association between the vaccination and the lack of infection and the lack of transmission. And there are still several unknowns. In this regard, it's important also to highlight that the US has released a new CDC US has released a new guideline and recommendations on the 2nd of April, but still there is no date just set for reopening the cruise ship in the Americas, at least. Over. Thank you.
Muchas gracias, doctor. Siguiente pregunta.
Thank you very much, doctor. The next question connected to the variants, and this is by Gabriela Granados, who is with the Japanese TV HNK, and also Juliana Fonteifer from Brazil. Gabriela is asking whether we can offer any updates in connection with the variants of concern that have been detected in the various countries of Latin America and the Caribbean, And the next question by Ms. Konsteifer is whether the genomic surveillance network may report on the genetic sequencing so far in terms of numbers in Brazil in general, and also the importance of this type of sequencing for the future of the pandemic, and also what needs to be done to increase test capacity. We have several questions. Dr. Aldigueri, you have the floor. Thank you very much for that list of questions that I will attempt to put together. As of April 5th, 35 countries and territories of the region had reported at least one variant of great concern, but also 20 of those countries and territories had detected the P1 variant. So we are working on the genomic surveillance aspects through a regional network that is coordinated by PAHO in close cooperation with the GISAID platform. It is a public database with genomic sequencing for SARS-CoV-2. Today, in that GISAID database, we have all of the regions of the world and several countries in the world, and there are reports of more than 5,500 sequences from Brazil that were reported by 22 labs in Brazil. Why is it important? With that information on sequencing, it is important, or it is possible, to understand viral transmission and introduction. Also, data on sequencing is also important to provide information on the current circulating lineages, to also compare to vaccines and also improve molecular diagnosis. This is the PCR that the whole region is using and that they started to use early in the pandemic, as well as the development of antiviral medicine. We are working through that regional network to increase sequencing capacity in the region, but it is so important that it is important to have a good number of reports, but also the quality. The sequences that are generated need to be of good quality, to be properly analyzed, and also to have an impact on our decision making. So PAHO is not only supporting the implementation of the sequencing capacity, but also providing support with validated protocols and reagents to have better sequencing quality. The new generation sequencing is technology that may be costly. It requires great technical capacity for the analysis of the assessment of the results, and that's where the countries need to mutually help themselves with the idea of being sustainable and having access to reagents, and also with properly trained human resources. I hope I have addressed that long list of questions on this topic. Thank you.
Siguiente pregunta viene de Nicaragua, de
Thank you
Abigail.
very much. Next question is from Abigail Gallo, Radio Corporación Nicaragua, and it says Nicaragua maintains vaccination for people older than 60, and they don't give priority to doctors in general. So the question is, what recommendations from PAHO to the government and the health ministry, taking into account that the frontline physicians will be taking care of infected people, and what is a message being sent by PAHO to the state? Because apparently during Holy Week, over 3 million people mobilized, and this is something that is keeping doctors on alert, and they are looking for an increase of infections due to COVID-19. Dr. Ugarte. Yes, thank you very much for your questions. Vaccination started in Nicaragua a few weeks ago with the Sputnik vaccine, and it has been administered to people with chronic diseases. Yesterday, they started with a vaccination campaign, 16 vaccines plus the COVID vaccine. That's their regular, the 16 is the regular schedule. And this for people over 60 and with comorbidities. On a second phase, the healthcare workers would be included. We recommend, of course, a set of priorities, among them healthcare workers who are in the front lines to respond to the pandemic and also care for people who are ill. This is something that the governments analyze and then make their corresponding decisions. We continue to provide technical cooperation for operational aspects of the vaccine, but also for the process of looking for information related to coverage, protection, and other aspects related to vaccination against COVID-19. Regarding the issue of the Holy Week, our director mentioned it, and it has already been mentioned here before. The fact that decreases in numbers of cases in some countries and in some areas should not mean that there should be carte blanche in reducing public health measures, because in fact, when those measures are decreased and when crowds are promoted as well as mass events, and when people come closer without wearing masks or washing their hands or taking appropriate measures in crowds, cases do grow significantly. We hope this won't happen in Nicaragua, but an appeal is made to the population. As Dr. Barbosa also mentioned, the vaccine is still far from achieving levels of community protection, and therefore it is necessary to continue to carry out the measures that have been recommended, the public health measurements, in order to protect people. Thank you. Thank you, Doctor. The next question is from Donald Siegler, and it's in English. It reads,
to increase vaccine production in the Americas, Dr. Etienne?
So let me thank you for this question. Because of the global limitations on manufacturing vaccines, it has been difficult for our region to gain access to the vaccines that we need to immunize our populations. We see the unrest and the anxiety in many of our countries because of this. Vaccine production for approved COVID-19 vaccines needs to increase worldwide because of the fact that none of us will be safe until all are safe. And while it may sound simple for technology transfer for vaccine production, it is really not simple. We in this region will have to mobilize our production facilities and modernize the vaccine platforms in the countries of the Americas. And we are working with partners in the Inter-American system to advance on these fronts. Attaining vaccine equity and distributing as many vaccines as possible to as many people as possible is our current goal. I think we need to find ways to share vaccines more equitably, whether it's through donations of surplus doses, whether it's through ramping up production or increased procurement or other avenues. What I do know is that current progress is far from reaching the coverage that is necessary to protect the most vulnerable groups, about 20% of the population, and to reduce the high mortality in our region. We are even further from reaching the vaccination coverage that is needed to achieve herd immunity against COVID-19, about 70 to 80% of the population, and thus control transmission. But in the meantime, I want to emphasize that vaccines are not yet the main method of slowing transmission for COVID-19. As we've said repeatedly, all of us on this panel, we must maintain and adjust our public health and social measures in every country. So I take this opportunity again to urge governments to keep advising their people to stay safe by practicing physical distancing, avoiding crowds and close contact with people outside their households, and practicing the wearing of masks and the frequent hand hygiene.
Gracias, doctora Etienne. En seguimiento a esta
Thank
pregunta,
you, Dr. Etienne. Diego Junqueira from Agencia Reporte from Brazil asked whether PAHO is monitoring the manufacturing process of vaccines in the region and whether we have information of the initiation of production in Argentina, Mexico, and Cuba. Dr. Barbosa, over to you. Thank you for your question. It is a complement to the question answered by Dr. Etienne. We needed to take advantage of the technical development of our region to decrease vulnerability, not only for vaccines, but medications and individual protection equipment. At present in Latin America, we have some projects of technology transfer. In Brazil, Mexico, and Argentina, we have processes for the AstraZeneca vaccine as well as the Sinovac vaccine. In Cuba, we have development of a vaccine in Cuba, which is on phase 3 of clinical trials. So there are these efforts of developing vaccines. There are other vaccines developed in other Latin American countries, which are still in their initial phases of clinical trials, either phase 1 or phase 2 of clinical trials. So both through technology transfer agreements and through supporting development and production of vaccines, we hope to have a better ability by the region to offer vaccines to the population. As has been mentioned here, the equitable access to vaccines is a main topic. Latin America and the Caribbean are receiving fewer vaccines than they need. And so we need to keep thinking about how we could have a strengthening of the manufacturing capacity in the region to have faster access and more equitable access in the region of Latin America and the Caribbean. Thank you. Thank you, Doctor. We have some questions related to Venezuela from Manuela Garcia, Crónica Una, Manuela Sujetro, de Efecto Cocuyo, among others, who want some updates on access of Venezuela to the COVAX mechanism. And they would like to know what would be the first vaccine to be received by Venezuela through COVAX, and whether we have information as to how vaccination of health workers is progressing. Dr. Ugarte, over to you. Thank you very much for your questions. Negotiations and conversations are continuing, and efforts to unblock resources of Venezuela abroad are still also underway. So payment has not been made to COVAX to access this facility. And in this sense, once payment is made, and once the new vaccines will be available through the facility, we will learn what vaccines would be available. Those vaccines are offered to the country. The country evaluates the situation, and then they decide whether to accept those vaccines or not. It is a process that is underway regarding availability of the vaccines that will be available in the next few weeks, allocated to COVAX facility for allocation to Venezuela. It is a process that is based on negotiations and conversations that have taken place in Venezuela, and we hope they continue on. Now, regarding the administration of vaccines, the process continues in Venezuela. Information is the same as spread through official media. So our role is one of advising and also technical assistance. And the information that we have is that available through official channels in Venezuela. Thank you. Thank you, Doctor. We have several journalists asking on the Q&A. Kevin Alvarado from Trinidad and Tobago, Reina Ochoa from Uno TV, Mexico, Katia Rojas Toro from Destino Panama, and Jasmine Brown from Our Use Bahamas, among others. And they would like to know, after what was announced by the European Agency about the AstraZeneca vaccine, what is the opinion of PAHO regarding this? Thank you, Sebastian, for this series of questions. Extensive, massive vaccination campaigns, as are going on right now in the world, usually countries begin to make a list of side effects post-vaccination. It doesn't mean that necessarily those adverse events are related to the vaccine per se, but it's necessary to evaluate them. The surveillance system of adverse effects exists, and there are effective controls. Now, WHO is in constant contact with EMA, the European Medicine Agency, and other authorities in the world to obtain more information and more recent information updated regarding safety of all vaccines against COVID-19, including the one manufactured by AstraZeneca. Today, the EMA has declared that they continue to evaluate safety data available for AstraZeneca vaccine in collaboration with WHO. EMA's evaluation says that there have been 62 cases of rare coagulation disorders, disseminated intravascular coagulation or thrombi in the cerebral sinuses, and 62 over 30 million doses administered. With the available information to this point, both WHO and EMA considered that the benefits of COVID-19 vaccine from AstraZeneca vis-a-vis the morbidity and mortality risk placed by COVID-19, I repeat, the benefits outweighed the risks, and they recommend vaccination to continue. In this context, it is recommended to do strict follow-up of all vaccines against COVID-19, and that research and recording of all adverse side effects be maintained thoroughly. And I hope I have answered your questions. Thank you. Thank you, Doctor. The next few questions are from Michael Stott from the Financial Times in London and Marcela Vélez from the Diario Financiero de Chile. The question is similar. The question in English is,
that Chile is seeing such a sharp rise in coronavirus infections and death despite having the highest vaccination rate in the Americas. Y también, is this because of the prevalence of the Brazil P1 variant or low efficacy of the CoronaVac vaccine being used in Chile, or is it there some other reason? Doctor Barbosa, ¿podría contestar?
Thank you for these two very important questions. First, I think that it is important to remind us that this is not the first wave or the first increase in the number of cases that we are seeing in South America, in Chile, and in many other countries. Unfortunately, we now have more than 1 year of experience with the COVID-19 pandemic. We know what can work to decrease the speed of the transmission. we know what can control the transmission. So it's important to see that the same measures that were able to control the transmission last year against the original virus, they are still effective against the new variants. So I think that it's very important to remind people that wear masks, to keep physical distance, to avoid crowd and closed space. The national authorities need to monitor very carefully the situation, and when it's in the places that the transmission is increasing, to adopt the proper measures to reduce the speed. I think that this is very important because the vaccines will not stop the transmission next week or next month. Even Chile, and Chile is a very good example, but unfortunately, it's not a unique situation in the world. We have it in Germany, we have in France, and in other countries in many parts of the world that have started the vaccination, but they are still facing new peaks that they need to deal with the public health measures that, again, we know that can work, that can be efficient to reduce the transmission. And why is this? Because the vaccination, to be effective, to control the transmission, probably will need to achieve a very, very high immunization coverage rate. Some models, some epidemiological and statistical models talk about at least 7% of the population covered with the vaccine and covered with the 2 doses of the vaccine, for the vaccines that are 2 doses vaccines. Other models talk about 80%. We really don't know yet what is the level that will provide the community, collective, or herd immunity. For this reason, while we are struggling and to get more vaccines to Latin America and the Caribbean, to have more equitable access, is very, very important. It's crucial to keep all the measures that can prevent the transmission by the original virus, by any other variants. So far, we don't have any variant that cannot be prevented by using the public health measures that we have good evidence that can work very well to reduce the speed of the transmission and prevent outbreaks and to prevent the other peaks and to prevent the hospitals and intensive care units to be overwhelmed during these peaks. Thank you.
Gracias, doctor. Siguiente pregunta de Melina
Thank you,
Ochoa.
Doctor. From Melina Ochoa from Uno TV in Mexico. Does PAHO recommend to those who have gone on vacation for Holy Week and Easter, it is recommended that testing, COVID-19 testing is carried out? Dr. Aldigueri, thank you so much for your question. In the context of Holy Week and Easter vacations, PAHO's recommendations have not changed at all in response to movement of people, including holidays and vacations. We recommend that the citizens monitor their health status and contact health authorities if they develop symptoms, and especially for them to respect the personal protection measures, physical distancing, social distancing, according to that which has been provided by the national standards and state standards in response to COVID-19. During a pandemic where the world becomes a village and lab resources need to be used in a rational way, these lab resources need to have the most impact to protect the community's health. So in this context, we know, for example, that the chief authority in the city, Mexico City, has recommended that those people who have gone on vacation and come back with symptomatology or are confirmed cases to go to the kiosks to undergo testing. I hope I have answered the question from the journalist from Uno TV Mexico. Thank you. Thank you, doctor. Next question is by Carmen Faun from Politico. It is in English and it says this.
Vaccine that you expect to be sent in big amount through COVAX after AstraZeneca? Is it Johnson & Johnson or Novavax? What's the next big target for COVAX? Dr. Barbosa?
Thank you for this question. I think that we are all concerned about how to get more vaccines. So the COVAX facility is working with the AstraZeneca producer. The AstraZeneca producer has 2 new sites in Europe, one in Italy, another one in Spain, that will deploy vaccines to the COVAX facility. We are expecting that maybe next week, these 2 new sites will receive the EUL, the Emergency Utilization License list from authorization from WHO, so they will be ready to deploy the vaccines. And this will be important because many countries in Latin America and the Caribbean are receiving vaccines from these 2 new sites. We also are expecting receiving vaccines from Pfizer starting in June. It's still a limited amount of vaccines, not the amount that we need for the region. And also Janssen will be deploying vaccine started in June or July. So this is a scenario that we need to call for a more political action from the heads of states. Our director is highlighting this situation in these press conferences almost every week, that we need to guarantee that they would need to work in a more coordinated way, in a more solidary way, in order to guarantee that the countries will receive the vaccine that they need in a faster pace. So the COVAX facility, the PAHO revolving fund, are in a dialogue with the producer. But we have a crucial limitation nowadays. These producers committed large amounts of vaccines to developed countries. So if we don't have a global agreement, a global common solution to release more vaccines from these producers, we still have limited access until the end of the first semester.
Muchas gracias, Dr. Barbosa. Siguiente
Thank you,
pregunta.
Dr. Barbosa. The next question comes from Manuel Perez from Agencia F in Dominican Republic and Haiti. And there's a similar question from Jacqueline from the Miami Herald. The question is, do you know when the first shipment of COVID-19 vaccines will be sent through COVAX to Haiti? And is there an alternative to the AstraZeneca vaccine? Dr. Ugarte. Yes, thank you. Haiti has been one of the countries that has had significant work in the process of preparing and being ready for receiving the vaccine. However, there are some administrative and legal processes regarding decisions that were made just a few days ago. So this means that Haiti will be ready to receive the available vaccine. As you will know, there was an initial first distribution of vaccines that had been envisaged for Haiti. We need to complete the processes so that Haiti can receive vaccines. We're all working hard with the government of Haiti, the health ministry, and other stakeholders so that Haiti can receive vaccines as soon as possible and so that they can initiate vaccination according to their plan. We are waiting to see what vaccine is available, and whatever the vaccine is that is available, Haiti is going to receive their shipment. Thank you. Thank you, Doctor. And the next question is from Kadim Joseph, health editor at Observer Media in Antigua and Barbuda in English.
Improvements to the accessibility of vaccines for the COVAX mechanism as more leaders condemn vaccine nationalism. Y también otros periodistas en el chat en seguimiento al principio dicen, how does inequality affect the response to COVID-19 in the region? Doctora Etienne.
Let me thank the journalists for this questions. So it is ironic that vaccine nationalism is one of the problems that the COVAX mechanism was designed to address. So by joining in COVAX, we are working to get everyone in the world access to COVID vaccines. And COVAX is a global approach to the pandemic to ensure that people throughout the world get access to COVID-19 vaccines as they become available, regardless of their wealth. So while it will take time to manufacture and distribute enough vaccines to all countries through the COVAX mechanism, it continues to be an important approach to resolve some of the inequities that our region face. This is important for the Americas, where our migrants, indigenous communities, and many people who live in rural and remote locations with limited care have been especially at risk. Today, nearly a quarter of our population is at an increased risk of severe COVID due to underlying health conditions, such as diabetes, high blood pressure, and obesity. In our region, women are shouldering the burden of the response, both at home and at work, and we've alluded to that several times. In addition to caring for dependents, women represent 70% of our health workforce, and many others work as essential workers in grocery stores, public transportation, and childcare facilities. This morning, we heard from an association of home workers, people who work in homes, and how little attention has been given to them in terms of prioritization. Children are also affected by this pandemic, and 140 million children across our region are still out of the classroom and falling further behind on this schooling. So while we have all been affected by this pandemic, we have not been impacted equally. And that's important that we continue to remember this. As I said, to fight COVID-19 effectively, we must address these inequalities and support the most vulnerable as they struggle to protect themselves. On this World Health Day, we are reminded that we need to begin with a certain level of urgency to address access to our populations who live in vulnerable conditions, to our populations that have so long been neglected. So I welcome today World Health Day as we continue to focus on health and well-being for all, as we continue to focus on the fact that if we are to stop this pandemic, but importantly as well, if we are to recover in a sustainable way from this pandemic, we must pay attention to the inequalities that are among us and begin to really confront those inequalities and address them. So thank you again for joining us on this World Health Day, and thank you every week that you join us. Thank you.
Muchas gracias, doctora Etienne. Ahora sí, entonces hemos llegado al final de nuestra sesión de hoy.
Thank you, Dr. Etienne. This is the end of our session today. I remind you to visit our PAHO website, and please keep in touch with us through email. Thank you for being here, and see you next week. Greetings to all.